Time now for Your Turn with Dr. Elizabeth Vaughan. Good morning again.
Good morning, Shannon.
We've got callers already on the line.
Great.
Robert from Summerfield is our first caller. Go ahead with your question.
Dr. Vaughan,
Good morning.
I have diabetes and sugar real bad. Would fish oil be good for me to start using? And what do you think about Forment, F-O-R-T-M-E-N-T?
That is a combination drug that has two different diabetes medicines in it, and that's a great drug. There's nothing wrong with it. This is where you want to do what you want to do is use the best of the drugs and the best of the supplements for your individual clinical problem. And with diabetes, probably the most important supplements that you could take is fish oil. So get a good quality fish oil. Pay that extra dollar for one that has been distilled and doesn't have any PCBs and dioxins in it. And you should probably work up to drinking or swallowing a total of 5,000 milligrams of EPA plus DHA a day. Take it at breakfast, you get a bigger bang for your buck.
All right, Lisa is our next caller. Lisa, what's your question?
Good morning.
Good morning.
I have been diagnosed with very high cholesterol also, and I know there's 3 different prescriptions on the market, and if she could please tell me the difference and if she recommends one over the other.
Oh, there are all kinds of different drugs. I mean, even the statin drugs have differences. Some of them are fat-loving, some of them are water-loving. It'd be hard for me to tell you and recommend any specific one since I don't know you personally. The important, though, the supplements that you can take and lifestyle changes that you can make are taking the fish oil, exactly like I told the last gentleman, working up slowly to 5,000 milligrams of EPA plus DHA with breakfast. And the reason I suggest taking it at breakfast is that's when it can calm down inflammation the most. That's when your cells are the hungriest because they haven't been fed overnight, and they will just suck up that fish oil and do all the repairs they need to do and calm down inflammation. And the name of the game in people who have high cholesterol is to calm down inflammation, because cholesterol is made by your body in response to inflammation. So calm the inflammation down and with fish oil.
Our next caller is from Greensboro. Jean, what's your question for Dr. Vaughan?
Yes, I have had a lot of problems with bone spur and actually wrapping around the tendon, the tendon on the foot.
So you have something like plantar fasciitis and a heel spur on your heel.
Well, it's actually on the sides. Actually, I had it on one foot and I had it operate on it. Now I'm having problems with it in the other foot. And a lot of times it's where it stretches and it's giving me a lot of pain.
Are you overweight?
Yes.
Okay, first thing you need to do, and I know it's a little bit difficult to do when you have a heel spur and your heel hurts, but try to lose even 5, 10, 15 pounds. If you did that, you don't have to get down to a magic weight, but if you lost 5 or 10 pounds, your heels would say, thank you very much, because it would be so much easier on them. The fish oil will help stretching exercises in the morning and at night before you go to bed. And I suggest that everybody pull their sheets out of the bottom of their beds, because what happens to you when you lie down at night and you stick your feet under the covers? You point your toes. So what you want to do is pull the sheets out from under your bed and then wear like a figure-of-8 wrap or an ace wrap to keep your ankle at a right angle, okay? So that that plantar fascia doesn't shrink overnight while you're pointing your toes. So keep your ankles at a 90-degree angle overnight. Good luck.
Jan from Lexington is our next caller. Jan, go ahead with your question. Jan, can you hear us? Uh-oh, I think we just lost her.
Okay.
Hello?
Oh,
Wait,
hello.
there she is.
There she is.
Yes, good morning.
Good morning.
I have had Bell palsy for about 4 months now. And I've took the medications that the doctors have given me. Do you have any more recommendations of what I need to do or what I can do on my own?
So you have Bell's palsy. Did it come on really quickly or gradually?
Really quickly.
Really quickly, okay. The medications you probably took was prednisone. What you can do at this point, 4 months out, and that's a little worrisome because you should have recovered more. Generally, you can get about 90% back. You may want to ask your doctor for a prescription for like treating the cold sore virus. So like Famvir or Zovirax or Valtrex. Sometimes Bell's palsy is triggered by the herpes simplex virus that's associated with cold sores. You may want to try a round of that. The other thing you can do all kinds of exercises that will help stimulate that nerve to regrow. And lastly, more fish oil and anti-inflammatories. You might want to consider using some B6, B12, folic acid, like a B complex with high doses of all of those, because that helps peripheral nerves regrow. Good luck.
Dr. Vaughan, thanks so much for spending some time with us this morning.
Thank you so much.
Have a great week.